Para a senhora, não?
Não.
Going from home to home in Paraíba, northeastern Brazil. Doctors from the U.S. Centers for Disease Control are now working with Brazilian health officials to research a possible link between the Zika virus and microcephaly. There's been a steep rise in the number of babies born with malformations in areas affected by the mosquito-borne Zika.
This is obviously something very important to know. We want to get the information out as soon as possible in order to be able to understand this and to, create public health activities.
It's been 10 months since the first case of Zika was confirmed, and medical facilities here are struggling to cope. There is still a lack of information, particularly with regard to its consequences.
Você teve sintoma de Zika na gravidez? Não.
What few doctors there are have taken to using any available technology to confer with clinics and patients further afield.
There are over 4,000 suspected cases of microcephaly. Of that, less than 700 have been confirmed. And tests are still being run to see if there is a connection between those cases of microcephaly and the Zika virus. With so little known, officials are asking everyone to do all they can to prevent being bitten by mosquitoes.
The Brazilian government has been commended by the World Health Organization for doing its best to handle a difficult situation. But its efforts don't seem to be making their way to the areas most affected.
We haven't received any extra money for combating the mosquito or even for treating those children with microcephaly. The research we are working on, all of that, so far it's the local government that has been paying for it. I cannot wait for them to make funding available. I need to make things happen here.
Whether linked to Zika or not, there are more babies now in need of special attention. In places like Paraíba, overwhelmed health workers are doing all they can to help families cope, one day at a time. Marga Ortigas, Al Jazeera, Brazil.